Strengthening Families webinar, which this time we are using for a technical assistance clinic. A number of you submitted questions about Strengthening Families implementation, and we are here ready to answer those questions and open a lot of them up for discussion so that the rest of you on the line can weigh in and share your responses and your experiences to help those who are asking questions about their own Strengthening Families implementation. So I will get us started, and we'll get into the questions pretty quickly. Just a quick overview of what we do with these webinars. We do this on the second Thursday of every month, and it's an open invitation to anyone who's implementing Strengthening Families or using the Protective Factors framework. And we encourage you to invite your colleagues if there's a topic coming up that's of particular interest to their area of work, even if they're not normally looped in on Strengthening Families. We convene these jointly between my organization, the Center for the Study of Social Policy, and the National Alliance of Children's Trust and Prevention Funds. And each month we coordinate a topic and a guest speaker, which sometimes is coordinated by the Alliance, sometimes it's someone from the network stepping up and taking on a topic and coordinating it, and sometimes it's from me at CSSP. We always post the recordings and the slides and any other handouts from past webinars. They're all on a Google site that's maintained by the Alliance. And for this one, we will put something up with notes about the questions and how they were answered. Just want to point out our upcoming webinars. On January 12th, we will learn about the new CCDF regulations and how they're affecting state quality rating and improvement systems for childcare. This is very relevant to some of your work and maybe not very relevant to others. So as usual, I encourage you to join if it's relevant for your work and invite others who might be particularly affected by it. And I would also say if you are administering the quality rating system in your state or jurisdiction and you'd like to share how you're doing that, please let me know. We'll be figuring out probably within the next week who's going to be sharing on that webinar, and so feel free to reach out if you'd like to share, and I will be reaching out to people who I already have in mind as well. Our next two will be in February 9th and March 9th, and just mark those dates on your calendar now. We'll announce the topics as we go. So for today, we're doing this technical assistance clinic. The idea is that we can all learn from each other, share experiences, and possibly even identify, someone might answer a question that you want to hear more about what they're sharing, and you can contact them directly, or I can put you in touch. We have a number of questions that were submitted in advance, and we will also take some questions as they're typed in. So I'll encourage you to use the chat box. Let's skip this part, but you can use the questions feature either to submit a question or to share your response to someone else's question. And depending on which platform you're accessing GoToWebinar from, it could look like either of these, either the panel down the right side of your screen with where there's a questions thing that you can hit the plus and expand it and type in your question, which is also where you will see other people's questions and our responses if we type anything in. Or you can raise your hand and we can unmute you. So raising your hand works with this little green hand wherever it appears on your screen. If you do that, we will see that you want to speak and we will unmute you. So use whatever way works best for you to get in touch with us. We really want this to be as much of a dialogue as it can be, or conversation as it can be over this webinar platform. So here's who's going to be responding to your questions today. I am joined by my colleague Judy Langford, who's a senior fellow at the Center for the Study of Social Policy. She has actually just stepped out of the room, but she'll be stepping back in momentarily, and she'll be chiming in with her responses on some of your questions. And then the other photo there is me. I'm Cailin.oconnor. I'm a senior policy analyst at CSSP. And we are joined by Martha Reeder from the National Alliance of Children's Trust and Prevention Funds. And Teresa Rafael will join us if she's able. She had a little bit of an overlapping schedule conflict. So she will jump in if she has a chance. And I know that Martha is here and ready to participate. And before we jump into the questions, Martha, I know that you wanted to share some upcoming training opportunities as well, so this might be the best time to do that.
Okay, thanks, Cailin. Essentially, I just wanted to inform you of the training of trainers for our Bringing the Protective Factors Framework to Life in Your Work. that we have on the schedule for 2017. We're actually having a training in Princeton, New Jersey next week, but that it's a little late to get involved for that one. But if you want to look down the road and you're interested in becoming a certified trainer for that training, we are scheduled to have a training in Oklahoma February 13 through 15, and also in Sacramento, California, April 10 through 12. So we're working on some other dates as well, but those are the two that we have firmly on our calendar right now, and neither one of them have registration links up on our website just yet. We're hoping to have those up after the first of the year. But I just wanted to let everyone know that those training events are in the works. That's all, Cailin.
Great. Thank you, Martha. And my colleague Judy Langford has joined me here. Do you want to say hello, Judy?
Hi, everybody. Cailin and I are actually sitting in the same room at the same time, which is very exciting from my perspective.
Doesn't happen too often, so we're excited to be here. And let's dive in. I did put some photos in that I have of who you all are on the phone. There's a photo there from our most recent Strengthening Families Summit, which was in 2014, and then a photo from a 2015 meeting of the National Alliance of Children's Trust and Prevention Funds. So all of these friendly faces are the people who can be chiming in to answer questions today. So we're going to jump into the questions that were submitted. And the first one came from Rebecca Murray and Becky Mather at the Wisconsin Child Abuse and Neglect Prevention Board. And it's about strengthening families' resources from CSSP. So their question was, there are a number of tools for child welfare workers. Are there any plans to make similar tools for family support staff or parent educators? And my first response to this is, we do have the self-assessment tool for community-based programs, which was really written mostly with family resource centers in mind. And we were thinking of other types of community-based programs as well, but we knew that the family resource center model was one that a lot of people use, and we wanted the self-assessment to apply to that field. The other thing I'll say is that those specific child welfare tools were developed through different contracts with jurisdictions that were really working to implement strengthening families in their child welfare systems. And it was a collaborative process. There's probably about 10 tools, and they were each developed, or groups of them were developed with different jurisdictions and then used with other ones and refined, and a group process to give feedback on them to finalize them. It was quite a process. We were really excited to be able to do it, but we just haven't had that opportunity to do the same in the family support field, and we would love to do that. So if there are tools that you have in mind, and you being Wisconsin or anybody else on the phone, that you'd like to see developed, let us know. Maybe we can find a way to work together on developing some of those tools.
Cailin, at the Alliance, we have some things that are emerging in the next few months that might fit this category as well. We have been doing some work with the Children's Bureau on developing a kind of a micro-learning training around preventing child neglect, and it's really pretty exciting, and it's going to be, we're hoping that it'll be out and available by April. And also another training tool that is available through our work with KC Family Programs is called Strategic Sharing, and this is useful for any a parent that's interested in using their own life experiences to help support their best practice and policy recommendations, and that our contact person for that is Merrill Levine, and actually there is a lot of that training being delivered all across the country right now.
This is Judy Langford. I just wanted to also mention CSSP is part of the National Center on Parent, Family, and Community Engagement for HHS, and our task is to create a lot of resources for Head Start programs and child care programs of all kinds around engaging families. And one of the things that'll be coming is the results of some research that Child Trends has done about competencies, the research-based competencies that anyone who works on engaging families needs to have. And that it's not ready for prime time yet. There are plenty of approvals that need to happen before it goes up. But I would think that looking on the federal website for those kinds of resources would also be a place to go, just depending on who it is that you, what kind of workforce you're looking to train in that way.
And then I will point out, you may see on your screen, we had a comment come in from Rigel Kraft in Pennsylvania who said, we've been showing the child welfare tools to parent educators and family support workers with some suggestions on how to modify. So those tools for child welfare are specific to different points in the life of a child welfare case. So sort of what are you doing in assessment, what are you doing in in-home services, and there are definitely pieces of it that you could use in other ways, that other systems that interact with families. So I encourage you to check those out from that perspective too, and maybe Rigel can share more if someone's interested about how they talk about modifying it. Okay, I think we'll go to our next question. I'm going to keep us moving. Last time we didn't get through all the questions that I planned on. So, this was a question that came from Sharon Murphy at First 5 Los Angeles, and it actually came from a couple webinars ago. This question came up, and I thought it would be good plugging in here about how do we prepare providers of universal services to better respond to families that are being referred from deep-end providers. So this idea being that if those deeper end providers are trying to do more about connecting families to other services in the community, how do we know that the services we're referring them to will be prepared to serve them well? And I think, you know, one of my responses to this is that I hope there are fewer and fewer places in the community that we'd be referring families where they aren't at all prepared to deal with families that are facing risks and challenges. I think we increasingly have service providers across the spectrum being much more aware of the challenges that families face, and even if that's not their primary, like if they don't target their services, they hopefully still are open to and able to serve families well who are coming from a place of crisis or more challenges. But I do think there's some other specific advice and things we can share. So I know Judy wanted to share something about that.
Well, I think one of the responses about this is to create a better connection between the deep-end providers and the providers of universal services, so that the universal services folks are better prepared, and so that the deep-end providers have a better opportunity to make sure that the universal services folks have the kind of training they need to take on those folks. And having said that, I think that one of the things that we're also looking into is the fact that the same ideas, the same ways of approaching families, the same ways of engaging families are consistent across all families, not just some families, or not just families that don't have any problems, or not just families that do have problems. But I think we have always, in Strengthening Families, tried to make sure that we were not unintentionally labeling people in ways that prevented them from seeing their own strengths, and from the other folks who are going to be working with them from making assumptions about what they can do and who they are. So I think, you know, just a better connection between universal services and deep-end providers is really the same. Is one of those ways of creating a better bridge for those families that are there.
And Cailin, this is Martha. I would also encourage any of the people that are on the call today that either are certified trainers that deliver the Alliance's face-to-face training, or you have access to those in your state, there is a lot of education that can be done around exactly what Judy was describing. Having those people, those providers, both the universal providers and the deep end providers in the same room, there are some very specific activities in the concrete support course that help community providers to be aware of what, to become more aware of what each of them, does, their contribution is in the community and how they can work together better. So I think that even, raising that awareness and just having that conversation through some of those activities could be really helpful.
Thank you, Martha. And another thing that I just thought of, this is Cailin, or that this reminded me of, was there was a comment on one of our recent webinars where someone said, we often talk about strengthening families as a language that can be a bridge across systems or across different types of programs, and that's very true, but we haven't really addressed how to make sure that systems know that they speak the same language as other systems. So sometimes we have cross-systems trainings happening in a community, so the child care provider knows that the child welfare workers got this same training and they can speak this language and communicate with each other in that way. But other times it might be that the child welfare people have an internal training that's very specific to how they're going to use protective factors, and they don't know that a bunch of the other service providers in their community have this training, or they don't know that pediatricians just heard about this. Some of the pediatricians in their town heard about this at a conference and are starting to think about families' protective factors. And so we need to think about how we not only do we have a common language across different systems, but we know where that common language is being spoken so that we can use it to our advantage. Because I think some deep end providers may be just unaware of which of the service providers in their community are using the strengths-based approach and ready to meet families where they are and serve them well. So I think that's something to think about at the community level and maybe at the state level of how do we make sure that the systems know who else is speaking this language. Okay, we've got another one which is definitely a question for the group, so prepare to type your response or raise your hand and speak up. Luann Beninati in Vermont is asking if anyone can share experiences with expanding strengthening families to family child care programs through a cohort model. And so I would expand this question to say anyone's experiences with family child care and anyone's experiences with using a cohort model to reach providers. We would love to hear about that. I have some examples I know from earlier conversations that I'm happy to share, but I see that Tish in Alabama has raised her hand. So Tish, I'm going to unmute you. Are you there?
Okay, does that mean everybody can hear me?
We can hear you.
Okay, great. Well, I was excited over that one. I will share that one of the things that we have done and are doing is because Alabama is one of those states that has the first class pre-K in it, and actually the Alabama Department of Early Childhood Education put strengthening families into their program. So for the past 2 years, we have been hitting hard and heavy that pre-K classroom and some of the early child care centers that happen to also partner with us for strengthening families. So one of the ways that it's been expanding is that we did ask that all of the lead teachers in the classroom take the online protective factors training course, and they have and are doing it as they have new teachers that come in, and we also are feeding them, I guess for lack of a better word, protective factors. They've gone through, a lot of the teachers have gone through training on the protective factors, and we are taking each one of the, starting in January, the 5 protective factors will actually be, and like I said, lack of a better word for feeding, but we are taking and working on each one of the factors. And so from January through May, they will actually in the classroom have one protective factor that's going to just go out to all of the parents. It'll do it via a newsletter through what we call our focus packet, to be able to literally just feed them a resource sheet that in that classroom those parents will be able to, on their time, look at that protective factor, look at some of the stuff, watch some of the fun videos that are out there, and whatever else we can get creative to hand them. So that's one of the ways that it's expanding here, is through our early child care centers and this first class pre-K.
That's great, Tish. Thank you for sharing that.
Yeah.
And oh, I think we're gonna mute you again. I'm gonna unmute.
Yeah, I'm sorry.
Oh, that's all right. Let me find you. There we go. And now we have Connie Dunlap in Wisconsin has her hand raised from the Supporting Families Together Association. Connie, you're unmuted. Are you there? Oh. Connie, are you there?
Yes, can you hear me?
Yes, that worked this time. Sorry about that.
That's okay. So we in Wisconsin have a 3-hour Strengthening Families training that we offer through our child care resource and referral agencies to all child care providers, family and group. And so that is available to all the child care providers, but we also, through our quality rating and improvement system called Young Star, providers are required to earn the family engagement point starting this in 2017 here. And with that, we've really embedded a lot of Strengthening Families pieces into that family engagement point. So, whether it's, providers using the parent cafe approach with engaging families in their program, or having, building social connections in other ways by having donuts for dudes or things like that. So our family engagement point in our Young Star program has Strengthening Family just infused in all of the different activities that providers can use to get credit towards earning that point.
Thank you, Connie. And are family child care providers included in Young Star?
Yes.
Okay. So that'll be interesting to see some of the ways that they do the family engagement point.
Yeah, we tried to make sure.
Go ahead, Connie.
I was going to say, we tried to make sure that when that there was enough activities for family providers, because we know that group programs, it's different for them to engage families versus a family provider. So we tried to make sure that there was plenty of ideas for both. So we really were thoughtful about that.
That's great. And is that somewhere online that other people can see?
Yes, if you go to the Department of Children and Family, the Wisconsin Department of Children and Families website, or just Google Young Star in Wisconsin, the evaluation criteria is on there, and the family engagement indicator is where you would find all of that information for what activities that providers would have to do.
Great, thank you. And Martha, were you about to weigh in too?
Yes, I was just going to share about a publication that we have that documents a project in the area of Spokane, Washington, where they combined these two strategies of kaleidoscope play and learn and the community cafe, which is based on protective factors, and unfolded this project in 5 different communities in that area. And the publication just kind of tells the story of how that happened. And many of you, I looked on the attendance list to see if Paula is on the call today, but Paula Steinke from that area has done a lot of work with Family Friend and Neighbor Care, and she was one of the authors of this publication.
Great, thank you, Martha. The other thing that I was going to say, getting more to the specific piece of the cohort approach, and this is actually an example from Wisconsin from many years ago when we first started implementing Strengthening Families. Some of the local CCR&R agencies put together sort of learning cohorts of family child care providers who got together for dinner once a month. And so a CCR&R educator was with them for this, at least to kick it off. I don't know if they stayed with them the whole time. And the providers would complete one section of the self-assessment each month and then get together for dinner and talk about it. And so it was a way for those family child care providers where they don't have a staff team that's going to do it together, and they don't have that discussion back and forth about, well, should we do this or should we try that? They were able to talk to each other, understanding each other's context and you know, the kind of relationship they have with families and everything. So I thought that was a nice low cost and community building approach that was sort of a cohort model, because you'd get a certain number of programs that were going to go through this together over however many months to work through the self-assessment. And I see that we've got, okay, Lola Cornish asked a question about where we can access the publication that Martha referred to. So Martha or Trish, would you be able to put in the link to that publication? And if you put it in the response to the question in the webinar, everyone else should be able to see it as well.
Sure, we're already working on that. Thank you.
Thanks, Martha. All right, we are firing on all cylinders here at the webinar. This is great. I actually see another hand was just raised. Oh, maybe it went back down. Okay, if you raised your hand and put it down before I got to see who you were, please put it back up if you still want to speak. So we'll keep moving, but you can always jump in. Oh, I see, Patrick Zimmer. I'm going to unmute you, and you can speak. Patrick, are you there?
Am I out? Can everyone hear me?
Yes, we can hear you.
Okay. So I'm just a master's intern for I'm in Shiawassee County in Michigan, and hearing everything that you're all doing, and as far as like the family cafes and that kind of stuff, it's actually giving me a lot of great ideas. So thank you for that. But also, it's kind of similar to what I'm doing in our county. So I'm not doing as in depth, just because I only have till May to do it. But I'm bringing to different organizations that work with families, particularly with the parents, rather than contacting the children through the schools, which seems to be working well for a lot of you, and something that I would love to see done in this county. Unfortunately, the school is not as cooperative, but I'm bringing all the factors with just like an hour and a half program, going through the 5 protective factors, discussing them with parents. Sorry, I kind of got a frog in my throat. Discussing them with parents and discussing different organizations and agencies in the community that they can reach out to help improve areas where they might not be as strong, and working with their children also on developing some of these factors with them.
That's great, and yeah,
So,
I think you probably would love to see more about the cafe approach, which is a way to structure or bring some structure to guide those conversations and make it more of a dialogue and conversation amongst all the parents, less so than a teaching experience. So it might be that once introduce parents to it in this way, they'd want to engage in a cafe process.
exactly, and I actually, on my notepad, and like 3 times as big as everything else, I wrote family cafe approach to bring to my executive director, actually, and see if there's any way that they could, after I leave, kind of do like a monthly round table in like a couple of the cities in the county.
Excellent. So if you need information about cafes, you can look at on strengtheningfamilies.net. We've got some information about cafes under parent partnerships, and we have a little description of some of the popular models that people are using, the parent cafe model, the community cafe model, and the caring conversations model. But we also have a fidelity checklist of sort of what needs to be happening in a cafe to be confident that it is building parent leadership and building those protective factors. So I hope you'll find that useful. All right.
Well, I will make sure to write that down. Thank you.
Okay, thank you. I keep losing my mouse. Okay, we're going to move on to the next question, which is from Roseanne Renteria in Arlington, Virginia, asking about what's a good strategy to help practitioners implement both Strengthening Families and Youth Thrive. And I think that's something that Roseanne, as part of a learning community around Youth Thrive, has been exploring too. And I think, I'm not sure if Roseanne joined us today. If you did, please pipe in. What I would say with this is, so if you're not familiar, Youth Thrive is a parallel framework of protective and promotive factors for youth, where it's very similar to the Strengthening Families framework. It is universal. It's about the characteristics that make youth more likely to thrive. It's kind of a giveaway in the title. And whereas Strengthening Families we started out implementing through early care and education and spread out to other fields from there, Youth Thrive at this point is primarily being used in the child welfare system to help systems better serve youth in their care. And there's no reason that other systems couldn't be using it as well, because it is a universal model, but that's just where the implementation energy is going right now from CSSP. But I will say that for practitioners who, in whatever field, serve families with children of varying ages, this is particularly relevant for child welfare caseworkers, but also, you know, if you're working in early elementary school, you're serving families who have kids in the Strengthening Families age range, but they may also have kids, or you may even be serving kids who are more in the older childhood youth age, and there's no reason you can't apply this strengths-based protective and promotive factors thinking to any family you encounter, and then to the youth you encounter, where you're thinking their protective factors become more and more important the older they get. Not that parents become less important, but that we need to focus on the youth's own characteristics and how they're going to go out into the world. So as far as a good strategy to help with that, I think we are working on incorporating more Youth Thrive content into Strengthening Families materials where it makes sense. And we are working on incorporating more Strengthening Families content into Youth Thrive materials where it makes sense. And really interested to hear from the field about how people are implementing it together on the ground, because we know that you are all very creative thinkers and take these materials and run with them. So if anyone wants to share about how you're doing that, we would welcome hearing from you. Anybody else have thoughts on that to share? Okay, I think that's all we've got on the Youth Thrive question. The next one is about how people use the Protective Factors Survey to evaluate across program models. So if you've been doing that, please raise your hand or type in a response. I can start by saying that the good thing about the Protective Factors Survey, which is also true of the Parents' Assessment of Protective Factors, the PAPF, which both are available on our website. The good thing with both of those is that it's about a parent's own assessment of where they stand on each of these protective factors. And it doesn't really matter which type of program they've been involved in. So I think you can train providers across multiple systems and program models in the protective factors approach and give them this tool to use, which is a way of stepping back from whatever program model they're doing or whatever program content they're providing, and just saying what's the effect that we're having on parents in these areas. One thing to note with that is that in the Parents' Assessment of Protective Factors, we do not have a section about knowledge of parenting and child development. In the Protective Factors Survey, that was the weakest subscale, and the newer version of the Protective Factors Survey that is being revised right now, they're changing that section a lot because it's really challenging to measure whether someone has gained knowledge or understanding of parenting and child development without asking specific questions that your program may or may not have addressed. So I would encourage you to have a tool that's about the specific knowledge or skills that you want parents to gain, but as far as measuring their protective factors more universally, those tools are both really helpful, and I think actually help, again, with that, using a language across program models so that your different home visiting models can compare and discuss how they're doing, what they're seeing parents report on the protective factor survey that they're both using despite having different program models.
Cailin, I want to just add in that we, the certified trainers that we work with at the Alliance, and there are almost 600 of those now, we have been looking, because they come from such a varied background, and it's across many different fields, and figuring out a way to evaluate the impact of their work. On our last networking call back in the summer, we asked Charlene Harper Brown to come and talk about the parents' assessment of protective factors, and also had someone from Friends to come and have Alicia from Friends to come and talk to us about the protective factor survey, because one of the things that we are doing, we're having a subgroup that's looking at how to use existing instruments like this to help measure the kinds of effects and impacts that the training is having on the community level. And so for those of you who, again, are using that training, to reach out in some sort of systemic way in your state, we are looking very closely at that, and Charlene and Alicia were very helpful in giving us the kind of information that we needed about how those tools can be used that way.
That's great. Thank you, Martha. I don't see anyone else weighing in, so we'll go on to our next question. Ken? So this is a very straightforward question. Do you have an established curriculum for playgroups? We do not. Strengthening Families is an approach and not a model, and so while we would encourage any playgroup model to think about, or curriculum to make sure it's addressing parents' protective factors, we don't have a specific curriculum, but I think we have a couple things we can say about playgroups. I know Judy wanted to weigh in on this.
Well, again, I think that Paula Steinke, who's going to be sorry that she wasn't on the webinar today, is the real expert on this, at least from Washington State. And the curriculum that they use there was developed partly from one of the original curricula that I know about is the Play and Learn curriculum from Hawaii, which has a whole evaluation component and a manual and all the things that need to be there for that. And I think that's the only one that I know of that is an established and evaluated curriculum that's out there. But I would say we should find Paula and ask her that question.
That's true. We also have Lola Cornish typed in that in California we partner with Kaleidoscope Play and Learn, yeah. Which I do think is what, it's that structured approach to playgroups. One other thing I was going to say about playgroups, we have a group of communities that have been working on a project about best practices for playgroups. This is through a related project at CSSP, our Early Childhood Learning and Innovation Network for Communities, or EC-Link. So they've been exploring how playgroups are being done in different jurisdictions, and this is across 4 different communities, or maybe 3 different communities and a couple different providers in each of those communities. So they looked at what was common across them, what does the literature tell us about playgroups, and how can we be evaluating playgroups. And one thing that I really like about this project is that it's not just looking at what is the specific impact of playgroup itself, but what role does the playgroup play in your early childhood system more generally. So while a playgroup, sometimes people could look critically at playgroups and say, well, it's sort of fluffy, or it's a nice thing to do, but it's not as important as some of the other more intensive services. But if we look at the role that playgroups play filling a gap in the system. There may be families who are not receptive to home visiting services but will come to a playgroup. There may be families who don't fit the eligibility requirements for any of our existing more intensive programs, but we can at least have some contact with them through a playgroup, or it may serve, help with the waiting list for some of those other programs, or it may just bring people in and open them up to receiving services in a way that they weren't going to if they didn't start with that soft start. And so playgroups themselves can have some impact on families, and then we also need to think about the role that it fills in the larger early childhood system. We did have a question typed in from Lourdes Garcia asking, where can I get more information on the Play and Learn from Hawaii? I'm not sure off the top of my head, and I can't Google right now because my computer is running a webinar.
We'll find that out. I'm sure they still exist in Hawaii. There is a manual. There was a whole group of people who provided training for that. Somebody who's on this webinar may know. And again, I think the Kaleidoscope folks, I will bet, are fully aware of how to do that. And I just don't know off the top of my head where to get that. But we will find out and post it.
And the other thing I was going to say is that the report about Kaleidoscope Play and Learn, which was posted in the chat box earlier, I'm going to put it here in response to Lourdes' question, because I think, if I remember correctly, that report has links to some other resources and may include the information you need. But if somebody else has that specific information from Hawaii, please share it. Okay, I think we'll keep moving here. Pat Zimmer, who spoke up earlier from Shiawassee County in Michigan, asked, what are some effective ways of implementing strengthening families on a community level? And I wonder if anyone else wants to jump in since I've been talking a lot. I am happy to talk more. All right, I'll go ahead and talk because no one else is jumping in right away. I think when we look at implementing on a community level, this is an area that I think is ripe for more work because it's happening in some places and we haven't always captured and documented exactly how that's happening. But what we see is cross-systems training where we're bringing together different people who touch the lives of children and families and having them develop a shared understanding of a strength-based protective factors approach. I think that can be very powerful, even just at the level of the family is going to hear the same language no matter who they talk to. And we're going to get better at making referrals across systems when we know that somebody else was in the same training we were and has the shared understanding. I also think one of the things that comes up with implementing on a community level is who are some of the non-traditional partners that we should be engaging. If we want our community to be a place where families have support for these protective factors no matter where they go, then that means that we need to be talking to the faith-based communities, and we need to be talking to business people and the hospitals and the other entities that touch the lives of families, but not through traditional human services type of approaches. And we do have good models of that from around the country of the Strengthening Families churches. The Baptist Convention of New Jersey adopted that. And we see places where some of the non-traditional partners have really embraced the protective factors approach and want to know how they can help to build those protective factors when families are in their presence. We do have a comment from Emily Schuster-Waxberger, also in Michigan. She says in Michigan we're using the Paper Tiger movie as a means of publicly speaking about resilience and other protective factors. And I think both Paper Tigers and the movie called Resilience are both tools for that. There's other documentaries that can be used in that way, like The Raising of America can open up a conversation about how is our community supporting and nurturing the children and families that live here. And then Strengthening Families is one way to move forward with that. Anyone else have thoughts to share? And it looks like Emily has her hand raised. So Emily, I'm going to oh, you went away. I was going to unmute you, but it looks like you put your hand down. So if you would like to speak, please raise it again. Okay, here we go. Emily, are you there?
Yes, I am. I wanted to share that Michigan, the Children's Trust Fund local councils throughout the state who are all engaged in primary prevention work, all of their work plan activities and programming must be based in the protective factors. So one way of really implementing the Strengthening Families Protective Factors approach on the community level is all of the great programming that is taking place in Michigan. And their work plans are not approved unless they are aligned with the protective factors. And within that comes a whole array of different opportunities where they go out and they are speaking about paper tigers. We are beginning to address the resilience movie. We just received training on that, and a host of other very current topics, the topic of distracted parenting and the effects of social media. I mean, so all of those kinds of opportunities are all across the state.
That is great. Thank you, Emily. Anyone else want to? Oh, go ahead.
I was going to say, if Patrick, he's in Shiawassee, if he would like to get in touch with me, he, you know, you can get in touch with me through the Children's Trust Fund of Michigan. I'd be happy to chat with him, or anybody else. Anybody else.
Thank you, Emily. We had another comment typed in from Lourdes Garcia saying SBCC in Los Angeles is a great example of how we incorporate the protective factors, specifically resiliency, through strength-based community level work. And Lourdes, I don't know if you're in a place where we could unmute you and you could speak about that a little more, because I don't think most people are familiar with that work. I don't want to unmute you if you're not prepared for that, because you could be in a loud place or something. Judy, do you want to say anything about it?
I just think there are lots of examples that I think are really interesting, and I think the conversation here is exemplary of those, of the interest and the things that we see. It's really very interesting. And I just, you know, I think that one of the things that we hoped when we first started fooling around with these protective factors was that it would generate a lot of interest in a lot of different ways that we couldn't have even imagined when we started, for communities to and families to rally together around kids. And I think it's just always rewarding from my perspective to hear more about how people are actually doing that. And I think some of the ways, like the Michigan policy of making sure that everything's aligned, really goes a long way toward creating the kinds of linkages across different sectors, the different program models, and different people in the community to rally together around what families need and what kids need.
Mm-hmm. One other example that I love to give, and since we're talking about Michigan, we always talk about this this event in Leelanau, Michigan, which I'm not sure if it's still going on. The example is from a while ago, but I hope it's still going on, and I think other people around the country have taken the idea and run with it. And that was the idea of a family night at the laundromat. And so this was the laundromat and a pizza place across the street from the laundromat deciding that for one night each month or on some regular basis, they would make laundry free and provide free pizza, and work with the child care center to provide some child care so that parents could come in, do their laundry, get dinner for themselves and their kids, and get a little bit of parent education while they were there. And it was a community building event. It was definitely building goodwill for those businesses among people who were their customers throughout the rest of the month as well, and then meeting some concrete needs of families while also, you know, pinging all those protective factors at once, basically. So I love that example. I would love to hear if anyone else has taken that idea and run with it, or if someone from Leland wants to say, actually, we don't do that, or correct my example. But I've always thought that that's a great example of businesses, you know, having a stake in communities, and understanding that there are different ways they can support families as well. We have another comment typed in from Lourdes, who said she was not prepared to speak, not in a good spot for that, so she's continuing to type in a bit. She said, we are an organization that focuses on community empowerment by creating community groups called NACs, Neighborhood Action Councils. Together we've created a movement in which we've engaged LA County. The movement is called Connected Families, Strong Kids. So that is fantastic. And Judy is nodding. I think she's aware of it, and I think a lot of us would like to learn more about that. I'm just putting a thank you here so other people will be able to see it too. It should pop up in your chat or question box so that you can look that up if you like, and hopefully we can all learn more about that as we go. We are actually at the end of the submitted questions that we had. So I would open this up for any other questions that anyone has or anything you wanted to share in response to other people's questions. We will give you a minute. Feel free to raise your hand if you'd like to speak. And Martha, did you want to add something?
Well, just it did have a little bit to do with the question we just finished, but about effective ways of implementing strengthening families. It could be on a family level, a community level, and that is the effort that our Parent Partnership Council is involved in right now. Those of you on the call that were also on the call back in June when they shared the first infographic around resilience, they are now working on the next one on social connections, and hopefully that one will be ready maybe sometime in February. And the way that they are collecting these very specific examples of how families are building protective factors, and in this case social connections, that often has a lot to do with community work, is that they have developed a survey that is based around all the everyday actions that are in the logic model, and will be distributing that survey widely among all the Children's Trust Funds networks, and anyone else who would like to receive that link to share that with your parent networks, we would really be glad to involve you in that process as well. We hope to get a lot of data from that survey.
That is great, Martha, and I'm sure you guys will be announcing that when it's up and ready on these calls, but certainly feel free to type the web address into the chat box as well for people to see that the resilience handout if they haven't seen it yet, and where to go for future ones. I love the work that you guys are doing with the parents on that.
Thank you.
Do we have any other questions coming in? I'm not seeing anyone raising their hand right now. I think what I'll do is put up our contact information. This is myself and Martha, so that you can reach out. I also encourage you to follow up with the other people on this call if they shared something you found interesting. I think we may actually wrap up a bit early, and I'm pleased that we got through all the questions and that all of you chimed in and we had some good discussion. Please let me know if you had other questions that weren't answered, which could be, you know, I can store them up for another call like this later down the road, or we could do a specific webinar on a topic that's of particular interest. As always, thank you for your work in your communities and your states, and we really appreciate everyone taking the time to share your wisdom with each other and learn from each other. So thanks, everyone. I think we'll call it a day. Thank you.